So are your headaches being caused by your bad neck? You know, I'm Dr. Aaron Wall with Gateway Chiropractic here in Fort Worth, Texas. So are you getting headaches frequently? And when I say frequently, I think a lot of people downplay how severe headaches are in this country. They're not a normal thing to happen. It's when your brain's not getting enough blood flow, but it's so common that people think it's just a normal thing. It's not. And the reality is 1 in 4 people get headaches regular. And regular by definition is at least 1 to 2 times a month or more frequently than that. That's regular. So if you're in that boat and you're like, man, I got to start figuring some stuff out, but you don't want to take a bunch of drugs that don't actually correct the problem, that just medicate you through this, we got some solutions for you. And this is one thing we want to talk about, because there's something called a cervicogenic headache. This is something that results from your neck being so misaligned. There's a term that we use in chiropractic called subluxation. It's when your spine, or your neck for that matter, is so out of its normal position that it actually compresses nerves, it stretches them, it stretches the spinal cord, and it stretches arteries. So there's a normal position, you might not have known this, that your neck needs to be in. So if you're looking at me, just like this spine model I'm going to show you, your neck should be straight just like the model. When your neck is straight, these holes for the nerves to come out of, they're big and open, nothing's going to compress. These nerves are running a lot of muscles, a lot of tissues, they run your arms and hands, but you can see these red guys, these are vertebral arteries that go through your neck bones, and this delivers the main blood flow up through the skull. This is like the back of the skull, and right into the brainstem, right into the brain. This is how your brain gets its normal blood flow and nutrition, all that stuff, oxygen. So you want your spine to be straight, your neck to be straight here from the front. Now from the side, so if you're looking like this way at somebody, you should have this C-shaped 45-degree curve in the neck. That's normal. The neck is not supposed to be straight from the side. That's kind of one of the problems that we want to talk about. If you have this curve, discs are healthy, bones are healthy, spinal cord, nerves are healthy, and you're getting nice blood flow to the brain. A cervicogenic headache is kind of characterized by intense spasm, muscle spasm here towards the trap area, base of the neck muscles, and that kind of goes all the way up to the base of the skull. So there's a lot of intense pressure, a lot of pain here, and then you can start seeing that it kind of goes around the head, but also up above the head, kind of over around the eye area so it's kind of like this, like your head's in a vice, kind of a cross between a tension and then kind of getting into the eyeballs, like throbbing type of a response. So not fun, and a lot of people get this. So what is that a result of? It's a result of, over time, the neck is subluxated. It starts to lose the curve, and it starts to get very straight. So we start to see people in our office like this. Well, how would you know that's going on? Your posture really is a window to your spine health, your neck health. And a lot of people, due to technology, due to desk type, seated type positions, driving a lot, tablet, phone, everybody's on their phone these days. What happens is, as you're in the head down position with maybe work or whatever, that has gone up so much that now the head starts to stay like this. That pulls your natural curve out of your neck when you're looking down. And then if you've been doing that for years and years and years, you start losing that curve. These muscles get weak, and then they get inflamed. So one big factor that we look at with patients when they come in and they're having headaches, we look at their neck posture. Is their head in front of their shoulders? Are their shoulders rolled in instead of back? Do they have swelling, or a lot of people call it a hump, that's forming right here? You will characteristically see those warning signs if you've lost your curve. Now, obviously, the best testing that we do is digital x-rays that can let us know exactly how much curve is lost. How do we go about correcting and adjusting it? Because that's what we do in the office. Is somebody that has a lot of headaches and they have no curve in their neck, one amazing thing starts to happen when you start to bring that curve back and train the body to hold that. You start getting the right amount of blood flow to the brain, you decrease the muscle spasms, the nerves start firing better, and the patient starts to have less and less and less headaches because you're actually getting after the root cause. And this might make sense. Like, if you're having a lot of headaches and you're taking a lot of drugs for that, and you're still having the headaches, think about this. If it is your neck causing it, and I would say in about 9 out of 10 patients, it's the alignment of the neck that's causing their headache to happen. But if you just medicate somebody and you don't ever go after the cause, they'll never get better long term. They'll always have to be relying on drugs to get through the pain. But if you can start correcting the root cause, you can start actually healing up, and you don't have to take the medications because you're just not having headaches anymore because you're healing. And that's kind of something that maybe that opened kind of like your mind a little bit as to, wow, this actually might be what's causing you to have your headaches. But if that's you and you want to do a different approach, start actually getting to the root cause and stop having these headaches, stop having to rely on the drugs, we can help you. That's what we do. We've been doing this for almost 20 years. We have helped thousands of people like you. But there's a schedule my appointment link next to this video that you're watching. Click on that, pick a time, give us a chance. We got a really cool special for new patients, and we'll get to the bottom of your headaches and figure out the root cause and start getting you to actually heal up. So I'll see you in the next video.